Another question that we are often asked is, what if I were to get the pellets and do the pellets for some period of time and then decide to stop? And that's certainly, doable. Some people do stop for whatever reason. I will tell you, most people come back after stopping because they recognize that the benefit was greater than, it kind of became their new normal. And so they maybe didn't realize they were getting that benefit, but then when they stop, they go, oh, I get it. So if a person would choose to stop with the pellet therapy, that's okay. I mean, it just simply means that your blood levels over the course of a few months would be reduced back down to what you're naturally producing. And frankly, you're gonna feel the corresponding symptoms and issues, but otherwise there's no negative outcome from stopping the pellets at any point in the future. We do encourage people to commit to doing the pellets for at least 2 or 3 rounds, which is going to take you 8 to 12 months, because there are short-term benefits or more immediate benefits, and then there are benefits that you may not recognize for several months. So for example, with the muscle building and the muscle maintenance, it's important to do multiple rounds of the pellets, because to build muscle does take time. So that leaning that you'll see, kind of that waistline you'll see again, the firming of your muscles, it will take 10, 12 months to recognize that outcome, as opposed to hot flashes, which will be resolved in 2 or 3 weeks. So there are some benefits that you're going to see pretty immediately, and there are going to be some that are going to take a little more time to recognize. There are no negative issues associated with human identical hormone replacement. When we're talking about synthetics, so that could be injections, that could be some of the oral meds, there are negative side effects from the synthetics themselves. If you're using bioidentical hormones, and again, the pellets are the purest way to get them into your body, there are not negative side effects. The biggest side effect could be that as your body's becoming used to having these hormones present again, your body might take a few weeks to recognize that. So for example, when a woman has been without estradiol for years, decades even, and now we've reintroduced estradiol, her body might, we call it celebrate, the fact that they're present again, but they don't really know what to do with it. If you kind of think back to when you went through puberty and your body was full of these new hormones and it's like, crazy, you're feeling a little goofy, until your body figures out, what am I supposed to do with these hormones? They're here again. That can happen. So for women with estradiol, occasionally they'll have a little bit of weight gain, maybe 4 or 5 pounds. Typically that lasts about 6 weeks, and then those pounds shed, they fall off. They might have some fullness in their upper body. Again, a couple of weeks of feeling kind of chunky, and then within a few weeks it goes away. And so that's just kind of that initial response to the presence of those estrogen hormones again. Outside of that, typically there's no real downside to hormone replacement.